So, I had lots and lots of queries about something to tell about nosodes, something to tell about sarcodes. Especially, I had a lot of queries from students to say the indications where the nosodes and where the sarcodes are indicated. Yeah, welcome, Dr. Sandesh. So, I think I'll start first on that only because rather than wasting time, I'll just tell you something about nosode which I have seen in my practice. First of all, whenever you are prescribing, when you take a case and whatever remedy comes, maybe it is nosode or a sarcode, treat that as a constitutional remedy and then start your prescription or administration of medicine. First thing. Second thing, it is commonly said that, good afternoon, Amit, whenever you are treating a chronic case and after some time, the case comes to a stop or a halt and it does not proceed further. At that time, to remove the miasmatic block, we give nosode to remove the block and the medicine can work. For example, in case of arthritis, if your remedy is phosphoric acid and the patient is much better with phosphoric acid, but after some time the medicine stops to work. So instead of repeating or changing the medicine, first give a nosode as an intermittent remedy, and then after administration of intermittent remedy, you will find that the remedy which was indicated, that is phosphoric acid, has been working after the block has been removed. So this is maybe the second thing you have to see, the application of nosode. Third thing, nosodes are sometimes used as a prophylactic and given to the body prior to training of how to heal with the future infection. For example, diphtherinum acts as a prophylactic for diphtheria. Fourth, in prolonged convalescence. In prolonged convalescence, for example, if the patient has been suffered from if typhoid, he has taken typhoid medicines, and after that, he says that he is never well since he had typhoid. In those cases, also, if there's prolonged overconvalescence, or the patient is not out of the disease force, you have to give an intercurrent like typhoidinum so that it clears up the case, and then you can give the indicated remedy. Sometimes nosode can be given as a complementary medicines also. For example, remedies like B. coli can be administered as a complementary remedy along with the homeopathy medicine. For example, epismel also, nitramur also for urinary infections. Or when the patient comes and tells you that when the patient has never been well since the attack of disease. For example, if the patient says that I had influenza and after influenza I am still not okay, I'm still not feeling well, in that case, then you should start the treatment with influenza. So these are basically the indications where you have to understand and then prescribe a nosode or a sarcode. And this is how basically I go along with in prescription. Of course, it's a long lecture, but just there was a lot of query for the nosode. That's why I first wanted to clear that off. So I welcome Dr. Amit, Dr. Badri, Dr. Meera, Anja, Sneha, with Prakash and Venugopal. So this is something about the nosode which I want to tell you, and this is how, of course, then the preparation of nosode is something different. Than we have different types of nosodes like Veapsorinum and all. That's how basically we are prescribing nosodes. Now, if you basically have seen some of the nosodes, like we have pyrogenum or we have midorinum and sarcodes like thyroidinum. Now you can prescribe these nosodes or sarcodes also, which I do in lots of cases where I use LM potency, where I feel I have to repeat. For example, in case of carcinoma, I had a case where I had prescribed the patient carcinosin and then I had to repeat the dose. So I gave carcinosin in LM potency and it worked wonderfully in that case of cancer. So this is how basically I would suggest you to read nosodes is its indication, and if you find difficulty you can again ask me question, but these were the 5 and 6 major indications which I found very useful in my practice. So I would suggest you to listen and then go accordingly with the case. Hello Dr. Babel, hello Dr. Jani. So this is something about nosode. So next question, if we have some questions, I'll be happy to answer. One of the questions was asked that it was a very interesting case. I'll first discuss the case if there is no question. Good afternoon, Dr. Vaishnav. There was a case of a father had two sons, and The eldest son basically taking care of everything, the family, his family, his children, his brother's family, brother's children. There were four. There were there are two sisters. He had taken care of everybody, and he now at this age feels that he did not get the respect, and people now don't want him. They want to, yeah, hello, Dr. Alexander. They want to throw him away. They want to throw him out, and he is not respected. And he feels that I have done so much, and still people outcast me and don't want me in my life. So if you find, this is a very, very interesting rubric, that it is called as the patient feels very unfortunate. And this is a very, very important and innate character, unfortunate feeling. And I prescribe that patient a single dose of Aurum metallicum 1M. And Aurum metallicum 1M cleared up that feeling, the symptom, and everything. In that case, the patient became very positive. He was suffering from arthritis. Everything went on very smoothly. So this rubric of late, if you see unfortunate feeling, you have to remember 3-4 remedies which are very, very important and indicated in this type of cases, where first, of course, Aurum metallicum or carcinosin, and you'll be surprised, sorinum also is a very interesting remedy, Staphysaceae, arsenic, lycopodium, pulsatilla. These remedies basically have that unfortunate feeling. They feel that in spite of doing everything in life for everything and everybody, still now they are not been taken care of. People don't want them, and they have been running around to make everybody happy. So unfortunate feeling. This is a very, very important rubric, and very, very important remedies are there, which you will find in many of cases. So do think about this rubric. I cured that case of arthritis with a single dose of arsenic 1M. Okay. Hello, Dr. Ritu. Dr. Meera says deafness in old people. Now, see, whenever you are prescribing for old people, now you have to understand whether it is only deafness or everything is because of old age. Everything is because of old age. For example, if you open the repertory of Phatak, he has given a very interesting rubric, dotage. And he has given arsenic is a very, very important remedy for dotage. But if you have not read that repertory, and you feel that you only want some remedies only where old age is involved, and because of that age the hearing is impaired. So I would suggest, of course, arsenic is definitely there, but there are few remedies, which are very, very important, and you can try them in your practice. First is, of course, don't forget arsenic, because arsenic is mentioned everywhere. In old age also it is arsenic, and dotage feeling also arsenic. Second remedy that you should always remember, that if there is dotage, it is dotage. Yes. Second remedy that you should remember is, let me finish this, petroleum. Petroleum is a very, very important remedy when there is impaired hearing, especially in elderly person. Third remedy, again very, very important, cicuta virosa. So these three remedies are very, very important when there's hearing impaired in old age. Now, I was just telling you about that Phatak repertory. In Phatak repertory for dotage, if there are a lot of symptoms like impaired hearing and loss of memory, then prostate problem, then difficulty in walking, then twitching and all. So everything is because of old age. Then you have to take the grand generalization. The rubric is dotage in Phatak repertory. Two remedies are there. One remedy, arsenic, is very common, but the second remedy will surprise everybody. Which is the second remedy for dotage in Phatak repertory? It is Ethusa synapium. Ethusa synapium, it's a fantastic remedy called as fool's parsley, and it's a very, very important remedy for old age or dotage. And the most important symptom of Ethusa synapium, in that you have to remember prostration with sleepiness. Now, this is a very, very important symptom of Ethusa synapium, that is prostration with sleepiness. That is Ethusa synapium. And of course, arsenic, everybody knows, it's basically a very polychrist remedy. I've discussed that remedy also lots in my lots of webinar. So these are the remedies basically. Right lobe of liver abscess along with enteritis. Right lobe of liver abscess. Now, whenever if you are treating treating a case of liver abscess, it is very important to understand and treat it very properly, because if the abscess ruptures, if the abscess ruptures, then you are in for a lot of trouble, because there will be a lot of septicemia and all. So simple, if you have abscess of liver right side, think of 3-4 remedies which are very, very commonly used. And the first remedy that you think about, of course, that everybody knows, is Hiparsulf. First is Hiparsulf, and see, if you think Hiparsulf is very, very common, and this is very commonly indicated, but if you are specifically telling for right side, then 3 remedies should come to your mind. The first is Cilicia, the second is Belladonna, and the third is Lycopodium. These 3 remedies are very, very important if there is abscess, especially in the right lobe of liver. Tooth and root canal decay, radiating pain to ear, coupled with margin of sudden raise of sitting position. Yeah, whenever you are prescribing for toothache, and basically the decay and the radiating pain is because of the nerve involved because of the toothache, So in fact, I had cured one of the very beautiful cases of a toothache where the patient had just removed that tooth, and after that the whole tooth was removed, and then the patient started getting so much pain in the tooth and radiating everywhere in the mouth, and nothing gave relief. But that patient is much better, and according to me is 95% better, as the patient told. So toothache, of course, a very, very important, very, very painful. It's a very, very painful disease. Of course, that case was treated by Hekla lava. So toothache and radiating pain. So whenever if you get a toothache with radiating pain, you must think about 3-4 remedies which are very, very useful. Spigelia, Hypericum, Ruta, and Hekla lava. 4 remedies, very, very useful. Next question is panicky attack in narrow places, fear along crowd, respiration difficult during attacks, looking door to escape, needs communication, lack of confidence. See, this basically, if you see a lot of cases where the patient is having fear of going to the lift or in theaters and all, I have seen a lot of cases, if you prescribe on this symptom does not react. You have to think cases where you have written beautifully respiration difficult during an attack. So now you have to look at the remedies where the patient is so anxious, and because of that the respiration becomes difficult. So it is basically related to your mind, and this symptom is very important. For example, now if you get a case where the respiration is difficult, don't take that claustrophobia, because I have seen that only that part is removed and something else will start. As Dr. Hahnemann says, don't treat on symptoms, see the basic crux of the case. Now in your case, see the respiration difficult. Now, if the patient is having a problem of anxiety in the lift, in closed spaces, everything related to anxiety, So anxiety, what is the physical symptom? The patient basically has the dyspnea, the difficulty in respiration. 3 remedies which are very, very important, which I have used in my practice. And the first remedy should be acetic acid. The first remedy is acetic acid. Second remedy is camphor, and third remedy is phosphorus. These are very, very important remedies. But if the patient says that he is asthmatic, whenever there is some emotional trauma, whenever there is emotional suppression, the patient may have this asthmatic problem, then 1 or 2 remedies which are very, very useful that you have to never forget. And that remedies you can write down. It is Gelsemium, Ignatia, and Coffea cruda. So both I have given you, difficulty and anxiety. 59-year-old lady suffering from gallstone, should I give Filtauri 30? If you don't have anything, Filtauri, Cardosmar, Colosin, Belladonna, very well indicated. You can give. Hello, Dr. Ninave. Dr. Deepmala says, good afternoon. Dr. Deepmala says, good afternoon, sir. 45 years doing 9 to 6 job, menses stopped since 1 year after menopause, obesity, great prostration and puffiness in legs. Legs edema is relieved by Kali Kara. Now, see, whenever if you're basically treating a case, okay, and the patient has classically tell you that after the stoppage of menses, everything is increased. So don't go symptom wise, that if the patient has swelling of like kali karva has worked, if the patient has palpitation, the digitalis has worked, if the patient has falling of hair, acid phosphorus has worked, if the patient has bloating and distension of abdomen, then some other drugs have worked. Now go what the patient tells you. He has to, the rubric is elements from climacteric period. If you have elements from climacteric period, then there are 4-5 remedies which are very, very important that you must think before going further. First is lachesis, second is semicifuga, third is sulfur, fourth is pulsatilla, and fifth is kalibrome. These are very, very important indicated remedies. Of course, other remedies also are there. If I can remember, conium is there, platina is there, veratrum and zincum also there. But lachesis, semicifuga, kalibrome, which are pulsatilla, are very, very important when it is elements from. Okay, elements from. Yeah, so Dr. Ninave has a question. Case of CA colon with moderate enlargement mass lesion. Whenever if you have case of just I'll just finish one question. Whenever if you have case of colon, whenever there's a case where the intestine, it is very important first to see which is the most important presenting symptom. Whether the patient has pain or the patient has come to know because there was discomfort and the patient went for ultrasound and something else the patient patient got the symptom. So that is also important. But if you just want some remedies that the patient is suffering from cancer or tumor, and so one remedy that whatever I can understand, that is cadmium. Cadmium is very, very important remedy, and all forms of cadmium. It is either cadmium brome or cadmium fluor or cadmium iode. All cadmium. In fact, if you have read, cadmium oxidatum is also very important in these cases where there is what you call tumorous growth or cancerous affection of the intestine. Of course, also think about creosote, phosphorus, and methylenium. So these 6 remedy, of course, cadmium covers everything, but creosote, methylenium, phosphorus also is important. So remember all the 4 cadmiums: cadmium brome, cadmium fluor, cadmium iode, and cadmium oxidatum. These are very, very interesting and important remedies. You can start by just asking few symptoms and you can always get to the remedy. And best of luck, because it's a very interesting case and these cases have to be handled so that it gives confidence to the doctor and the patient and a homeopath. Rheumatoid arthritis after dengue. Now see, dengue is basically what happens if there is a dengue. So you have to understand and go to the rubrics where there is, first of all, there is metastasis from the dengue or viral fever to the bones. So you can take that rubric and go in the case, or you can say that after dengue, the inflammatory process has settled in the what you call bones. So both the rubrics would give you some medicines. Now, first of all, if you just want medicine, you must think about 3-4 remedies, and the first remedy you think about is abrotenum. First remedy is abrotenum, nux vomica. Third, then you have to think about kali carb. Then you have to think of sepia, sulfur, and phosphorus. Okay, I hope Dr. Singh, you got some entry of the case, menopause, climacteric period. That's very important to take the rubric elements from. So I think I talked something about nosode today, but I think those who wanted the answer, I think were not there in the first part of my YouTube, and that's why I tell you, please join in early, 5 minutes early, so that you don't miss out on what I want to tell you, because that was a very common question asked by many of doctors and students, and I gave you some 5 points to understand. I'll just sum up. As a second prescription, you can use a nosode or a sarcode as an intercurrent remedy for prophylaxis, or sometimes you can use as a tautopathic agent. For example, there are cases where the patient has used lot of B2 vitamin, and because their toxicity, then you can give an tautopathic remedy for the overuse of vitamin B complex. In case of prolonged convalescence, you can use the remedy, or as a complementary medicine, or when the patient says that he is never well since the attack of disease, then also we basically prescribe these medicines. I have told you again at one stroke, whatever I can remember. So please join in early so that I basically take the questions which are most asked in my WhatsApp group or Facebook group. So I was first in answering that questions. I'll definitely have a case next time and I'll tell you how to use a nosode for, or I can tell you a case of hypothyroidism. The patient was doing very very with calcareous iode. The TSH level from 26 came down to 7, and it just stuck. It just got stuck at the level of 7, and it was not increasing. So I started from calcareous 30 to 200 to 1M, but the case was not budging. The cure was halted. In that, I used a Sarcode, that is thyroidinum. I gave an intercurrent remedy of thyroidinum 1M single dose, and again when we checked the result after a month, the TSH level came down to 3.2, and the patient did not take any other allopathy medicine when he was on arm medicine. So this is an example where Sarcode was used as an intercurrent remedy in case of hypothyroidism. A case of tumor in the breast. A case of tumor, I actually had given something about so yes, abrotenum. If you see the repertory, if sometimes what happens that, for example, if you're treating disease A, that you suppress that disease and you get disease B, and automatically it is a metastasis from there to there. So if you look at the rubric metastasis, the first name is abrotenum. Of course, check diarrhea is definitely abrotenum. So tumor of the breast, now when I was discussing that glandular remedies, last time, I don't know when, but I had discussed something about this some tumor remedies of the breast, and I think we have done, but still for your purpose, whatever remedies, breast remedies, as it is said, like you can think about first, of course, Phytolacca is there, Belisper is there, Conium is there, Asteria rubens is there, Cistus canadensis is there, carcinosin is there, carbon sulf is there, carboveg is there. So there are a lot of bryonia is there, Calicarb is there, sulfur is there. So there are a lot of remedies, and I think we had discussed also Cistus scan in my last webinar. If anybody can throw light on that, it would be very good, because these all we have done before also. So if I just will sum up some symptoms of Cistus scan. Now, Cistus scan, I hope everybody knows that Cistus scan. I'll just finish one Cistus scan. So Cistus scan, basically, if you see, and you must have prescribed these remedies, but Cistus scan is a very very important remedy when there is induration and inflammation of the mammary glands, and the patient is sensitive to cold air. That's a very very important symptom of Cistus scan. So Phytolacca, the pain is important. Carbon sulf, the carbonimal is the blueness is important. Asteria rubens, again a very important remedy for CA breast. Conium maculatum. So these are a lot of remedies. You can always have these remedies in your metermedic, and of course see how to apply it. Symptom wise, maybe sometimes I'll discuss later if you want symptom wise, but these are the remedies. You have to remember breast remedies, and then you can get to it. So again, some questions are there on the Skype now, I think, for Sarcodes and Nosodes. Yeah, so again, something about Sarcodes and Nosode. Now, if I had to start something about Sarcode and Nosode, one of the Dr. Allens and Dr. Kent has already told that use the remedies when indicated. Don't have that like, if I have to start a case with Sarcode, I have to do with Sarcode, I have to do with that Nosode. If it is a constitutional remedy, first treat Sarcode as a constitutional remedy, and then if it does not work, maybe you can use Sarcode or Nosode, whatever I have told you in my seminar. For example, if you see Sorainum, if you see Syphilinum, if you see Medorinum, these are all Nosodes, and if you see Thyroidinum, these are prepared from healthy products. Now, I had already Sarcode and Nosode. This does play important. Yeah, Sarcode and Nosode, whatever I tell, basically, if I'm prescribing it as an intercurrent remedy for convalescence remedy or to open up the case, I use 1M potency. But if I'm using that remedy as a constitutional prescription and the patient is not drugged by a lot of homeopathy medicine, it has come directly to me, then I would start with a 200 potency. Great prostration after long COVID, legs weak with great pain. Yeah, so this, I think this symptom would be very common in lot many of cases. You must have seen that there is a lot of weakness, and the patient not able to stand also. See, there are few remedies which I think I've told so many remedies for weakness, but still think about three, four, five remedies which are very important and frequently indicated. Remember carbovage, remember China ars, remember China, remember muriatic acid, remember antimcrude and sorinum. These remedies, in fact, if I tell my practice, China ars, muriatic acid and China has given me very very good results in a lot of cases of COVID which were basically feeling very weak. But I would like to add one thing, Dr. Madan. Since I have made that COVID-19 nosode, I have been using that nosode in lot many of patients where either they are suffering from weakness, or either the patient says the cholesterol increased after COVID, or the patient says after COVID I had a lot of migraine problem, or the patient says after COVID I had a lot of pain in the body, or the patient says after COVID I had XYZ. So if the elements from is from COVID, now I'm using that COVID-19 nosodes and I'm getting very good results. But before that, I was using China ars, China, muriatic acid, antimcrude, soranum, carbovage. So I have given you both the answers. If you do have my nosode, try that. Otherwise, and a lot of I have asked every time that whoever doctor has used my corona nosode and they have got results, do share it so that we can make a good literature and sum up of the case. Dr. Alam says, sir, मुझे ड्राई एक्जिमा है, बक में जो माइट बी इचिंग बढ़ जाता है, इचिंग को कम करने के लिए. Yeah, see, if you have dry eczema and if you have seen cases where the patient is absolutely dry skin with a lot of dry eczema. Now, of course, there are so many remedies for that, but still I would like to say, if the patient is suffering from dry eruptions or dry eczema, two or three, four remedies are very very important, and you'll be surprised. I'll tell you one remedy which is very very rare, and I have used that in my practice and I have got very very good results. Dry eczema, dryness, eruptions are very dry, and that is kaolin, Kaolin, kaolin. The name of kaolin is alumina silicata. The second remedy which I have used is arsenic, arsenic iode, petroleum, and again one more remedy, and that is kali chloricum. Kali chloricum. So these 4 or 5 remedies are very important. Apart from there, I have also used kali ars, I have used silicia and zincum metallicum. Sometimes what happens, the eczema is so dry, when you start itching, it has lot of scratching, and bleeding is followed by scratching. Then use petroleum, sulfur, calcarea and arsenic. Hello, Dr. Minal. Dust allergy in wheat threshing season. Yeah, and as I have always told that whenever the patient is suffering from allergy or for anything, allergy basically, when the allergen goes inside the body tries to throw it out in the form of sneezing. So there may be some specific medicine for that sneezing, but the whole constitution has to be taken care of so that the body will fight that allergen. In this case, it appears very very simple that okay, wheat's allergy and then give the medicine. No, I would still suggest you take the whole case, go in the depth of the case, do the management analysis, and then prescribe the remedy. Because in this case, acute remedy, if you want, you can write on there. The remedies like histamine is there, orindo is there, ars iode is there, arsenic is there, synapse nigra is there. So there are a lot of remedies. 88 years, feeling of changing temperature, feeling ice cold and numb, ice cold in bones, feeling as if festering. Yeah, there is one. There is one remedy. It is called as constitutional coldness. Dr. Babel, such a fantastic. We have I think old age patients now. Woman 88 years, and next question from Dr. Alexander is patient 93 years of age. So we have constitutional. The patient is basically lacks animal heat or chilly. Of course, in repertory, if you see that if he wears a summer fur cap in summer, and then there are a lot of remedies, but constitutional coldness, you must think about kali ars. Kali ars would be the first remedy. Second would be arsenic. Third would be soranum, and fourth would be nitric acid. 98-year-old surgery of gallbladder and since then prostration. Since then prostration and all she wants is to sleep. She has difficulty to get out of anesthesia. Gave phosphorus but no result. Okay. Now, of course, anesthesia, and I'm very much surprised that why did not phosphorus work. But whenever we say anesthesia and the first remedy, which comes to our mind for anesthesia is, of course, definitely phosphorus, and you must think about phosphorus also. But there are few remedies also that you should think about. And of course, if you see, I don't know what is given in, of course, repertory, and this must be given. But can anyone guess which remedy you should use if there is side effects of anesthesia? Anybody? See, whenever the patient is complaining of these type of complaints, and if your indicated remedy does not work, which should have worked, there are 3-4 remedies that everybody should take, that use in your practice. The first remedy is phosphorus. Second remedy, I think I had told you once. Dr. Alexandra. Oh, the question has gone so up. You must think about 3-4 remedies, Dr. Alexandra. I think she gave up in life. Nux. Okay. No, the question has gone up. So remember the remedies. Phosphorus is first, second is chloroform, third is acetic acid, and the fourth remedy is carbohydrate. Phosphorus, chloroform, acetic acid, and carbohydrate. Chloroform, I hope you have, if you have not used this remedy, you must use chloroform. Chloroform has got fantastic results. I have seen in my practice, elements from anesthesia. And this remedy would work wonderfully if you have used this in 6 potency. It has worked fantastically. And acetic acid also. That remedy also will give you very good results. Of course, match just few symptoms of this remedy and you can definitely get good results. Yes, Dr. Bilwalkar is right, acetic acid. So, good afternoon, Dr. Sharon. Any medicine? Sir, please tell something, types of tongue. Yeah. See, what happens, you can have in homeopathy so many things, and then you keep on reading that types of forehead, types of tongue, types of eye, types of hair, types of nails. It is like you hear something from somebody and you feel, oh, this is very good, and then we should read that. But take the case as it comes to you. This is my very sincere opinion to everybody. I have practiced 25 years and by the grace of God, good practice, good results. Just take the patient as it comes. Just see to the patient. Don't make that, okay, I have also written one CD of types of forehead. But it is basically, now, if for example, if you are treating a case and you see the tongue is cracked. Now, cracked tongue has so many remedies starting from Elianthus to Zincum. You can think about Elianthus, arsenic iode, arsenic, fluoric acid, phosphorus, nitric acid, hyoscyamus, rustox, spigelia. But then you have to try and define that crack. Is that tongue cracked in the center? If you see it, then think about a very, very rare remedy, That remedy is cobaltum. Cobaltum is cracked in the center of the tongue, like nitric acid, like miserinum, and like Ruswen. I cured a fantastic case, a beautiful case of such a long-standing urticaria, where lot of polycrust remedy, acute remedy failed, but when the tongue, we saw the tongue, it was cracked in the center. Ruswen just cleared up the case. If you have cracked on the edges, then think about lachesis, Naxomica, Phagopyrin, and Thuja. Or when you see the tongue is black, Miserinum, China, phosphorus, carbohydrate. Then again black in the center, then phosphorus, Muxol, leptendra, and muriatic acid. In the same way, bluish tongue, brownish tongue, and see, there are dirty tongue, dark tongue, grayish tongue, green tongue, painlessness of tongue, purpleness, redness, lot of things. Then you can divide that. So it is basically, don't have a preconceived notion. Always remember aphorism number 6. Whenever I'm taking a class or a webinar or seminars, I always tell the doctors, remember the aphorism number 6, so that you are an unprejudiced observer and you can look at the case as it comes, as a different case, not as what you have thought of. Repeat, very difficult issue in hospital. And yeah, you can give chloroform 6 in repeated doses. I had a case where I gave chloroform 6. In fact, I gave chloroform 6 was not available. I gave chloroform 12C olfaction every half an hourly for 4 doses. Slight the patient started getting better, so I made the dose every 1 hourly for again 3 doses. And when the patient improved, then thrice a day, and then tapered it off. Depends on the susceptibility and the vital force, how much it is required to get the vital force back to normal. We will start to see fevers with thrombocytopenia. Thrombocytopenia. So what is your question? Thrombocytopenia means, what is the question? Thrombocytopenia is a condition in which there is low blood platelet. That what you want, the meaning of thrombocytopenia? Or in thrombocytopenia, basically there are main causes is ITP, idiopathic thrombocytic purpura, or a bone marrow disease, or a cancer. When, okay, one is woman 50 years, climacteric weight gain, excessive 4 times a week, eating uncontrolled, carbs just in the morning, a fruit for lunch, vegetables or dinner, no weight loss at all. Exercises 4 times a week. Okay. See, whenever we get cases, of obesity, and after a lot of exercise, also the patient does not. So, of course, we can give the medicines to increase the metabolic rate, But there are some exercises, and the intake of food is very important. You must take a lot of protein food, so that it basically lights up the metabolism. Protein food, lot of water intake, lot of fruit intake, green tea, and then prescribe the patient that consultation medicine. Now, if your patient is like it is not working, then you must think the rubric obstinate. Very stubborn patient, very stubborn weight. What is mind is the body. So stubbornness is important in your case. Go from the rubric stubbornness, then you will get the remedy. I saw a kid with extreme long tongue, extra long tongue. I don't have a case where the tongue was very long. I have never seen the case like this. So, in fact, I have never thought of it. Which remedy do you prescribe? This is how we learn, and I hope the long tongue I have not prescribed, but long tongue would be, I think, whatever I have seen in my practice. Sumbul is there for long tongue. Sumbul is there for long tongue, and I think I had patient where the patient felt that the tongue was too long. There was a sensation as the tongue was too long, and I gave that patient muriatic acid. But for too long tongue, I have never given the remedy for that. So it may be a delusion or a sensation which I have seen. But too long tongue, whatever I have read in Mater Medica, it is, I think if I am not mistaken, it is Sumbul, which I use basically for heart complaints. 50 years old, chronic smoker with peculiar complaints of leg swelling and burning pain 2 days before cloudy weather increasing. Yeah, so see, long tongue, and you have specifically written, I think, cloudy weather. So, cloudy weather. Now, we have constitution, hydrogen constitution, carbonate constitution, and these type of. So, basically, water accumulation constitution. So, if you have cases where the patient has a problem in cloudy weather, who's Dr. Mole. So, just write down 3-4 remedies. Of course, you must have heard remedies rhododendron. But write down rustox, manganum, silicia, pulsatilla, and sepia. And write down the opposite remedies where the patient is better in cloudy weather. Of course, first is causticum. Second remedy which you must have not heard, and it is very, very important, that is lappa. LAPPA, Lappa articum, ARCTIUM, Lappa articum, Causticum, Lappa articum, and I think Kalmia latifolia. These 2-3 remedies are better in cloudy weather or stormy weather, So you must remember both parts. 50. Urticaria appears only at night every year in Jan and Feb, swelling of lips, scratching. Yeah, so this is again, just a minute. And it's a very it's a very interesting, urticaria, such a disturbing disease, and some cases respond very well, but some cases does not respond only. So whenever if you get these type of symptom, 3-4 remedies which I have seen very useful in my practice. Of course, you must have tried that Bovista and Epismel, but again, there is one remedy called as chloral hydrate. Use that. Think of that remedy. Second remedy, one remedy which is very important, that is balsam of Copaiba. Very uncommon remedy, I'm telling you. And 2 common remedies that you think about is Naxomica and Pulsatilla. 59 years old is suffering from gallstone. Shall I give? Yeah, give Filtowry. It is a specific remedy. You can try that. Sir, Google Meet is missing. Please take webinar fevers, indication and patients. Yes. Yeah. I'm really sorry, Amit. I am not able to get that Google Meet on track. Of course, I will do that. And we because of lot of webinars, every second day I am giving a webinar to some of the groups, and that's why I'm not getting basically time. But if you have a big group, I can take a webinar for you only. So make a big group and I'll start the webinar. Don't worry, because I'm not getting time to collect my students and make it, because we are always doing a webinar after 2 days or alternate days, making cases, presenting cases. That's why. And by the grace of God, a few international webinars also, and it is working well. Yeah, Lachesis, belladonna, and he keeps playing with his tongue. Okay. My wife has severe arthritis, pain in knees, both very chilly, add salt, not pepper. Okay. Yeah, Dr. Amit. So if you say yes, you make your own group of a few doctors and I'll start the webinar for your group. It's very important that if somebody is handling, so I don't have to handle anything. So it becomes very easy for me, because handling a Google Meet everybody and then handling again webinars for different groups, it becomes very difficult at times. So it's very important that somebody handles and I have to just go and speak. That's easy. Yes, Dr. Dr. Vishaka, Naxomica and Episfail. Yeah. So I have given you 2 remedies which are very rest. Think about chloral hydrate and think about that balsam of Copaiba. And of course, you must think about few remedies which are very specific for urticaria. You must think about histamine. And I have seen in urticaria, histamine works very well. And in frequent doses. Yeah. So Dr. Amit, you make a group. I'll be very happy. Just a minute, doctor. I've just missed one. Yeah, Dr. Prajapati 1. Yes, if your wife is suffering from, of course, see, I don't want to give that cliched answer that take the whole case and this and that. So immediately, if you want a very fast answer, just arthritis and just chilly patient, few remedies that comes to my mind that you should remember. Anything else you can give me, doctor? Anything else symptom you can give me, so that I can basically be very confident in answering your questions. If your patient is chilly, if it is arthritis, if there is degeneration, you must think about 4 or 5 remedies that you write down. First, Muxol. Second, Ferrumphos. Third, nitric acid. Fourth, Oleum Jack. And fifth, Calcarea Carb. All remedies are chilly. All remedies are for arthritis. All remedies are for degeneration. And all remedies are for osteoporosis also. If whatever symptoms you have written, I told you, Dr. Vaibhav, child playing with hands frequently and specific rubrics, sir. Yeah, child playing with hand, you can have you can basically, if I get that type of case, there are 3-4 things that should come to your mind. You could say restlessness of the hand, fidgetiness of the hand, you can say tics, you can say anything in that case. But only for that symptom, I would not go for prescription. We must know why basically the child is suffering from the so-called disease which you are treating. Because I have never got a child where the patient says that the child is playing with fingers, do treat this because he's playing with finger. It may be a habit also. So make sure that what you are treating, that is important, Sir, we can. So Dr. Amit, I give you that authority, give you that. You make your own group so that you are responsible for everything, and then we can take a webinar. Thank you. Dr. Nice, for your webinar, please do it. Yeah, I will do it. Medicines, if you ask me, Dr. Webb, it's very nice that see, you must think about the 4 or 5 remedies that that should come in everybody's mind. The first remedy, of course, think about carcinosin, think about zincum metallicum, think about tarantula, think about arsenic, and do think about one remedy also, Agaricus muscarius. Very, very important remedy. Sir, ASO titer positive 225 with joint pain, please advise homeopathy. See, ASO titer is 225. So, Dr. Pradhan, if you could help me with few symptoms more, I could basically give you the remedies, because generally for ASO titer high with no symptom, I would be literally confused what to give. Summer boils, multiple, many patients. Yeah, summer boils, multiple, many patients. First of all, if the patient is coming and telling you that he has summer boils, and only in summer, do think about some remedies which are basically very, very important. Okay, very nice. Thank you. So very nice. If you have given that, it's very nice. So if you have this type of skin complaint, and mostly in summer, so you have to think about 3-4. I should not say that 3-4 remedies, because if you open the repertory and Matermedica, the remedies keeps on increasing day by day. We had at 20 years back for about summer remedy 10 remedies. Now we have 100 remedies. But few remedies that comes to my mind in these complaints, with the skin is very, you must think about, lachesis. You must think about, of course, natriumur is there, but antium crude. Think about lachesis, think about antium crude, think about natriumur, think about bovista, think about arsenic. These 5-6 remedies are very, very useful. And of course, don't forget the antisoric, the king of antisoric, sulfur, because you have to think about that, because it covers maximum complaints in skin. Yeah, very happy to know that you use agaricus, and it will definitely work. Because see, a lot of doctors I have seen that they have not used agaricus, and agaricus sometimes becomes not used remedy, and all the polychorus like carcinosin and tarantula and sepia, zincum, people will use and then fail. But I would suggest that, as doctor has also already used, agaricus is there, and there is one more remedy which I have got very good result, that is argentum nitricum. That also you can see in your practice. I hope, Doctor, for the urticaria, those 2 remedies you try, of course, differentiate that, and yeah, twisting of muscle, very nice, very nice. So 1 or 2 remedies that you should add, Dr. Vishaka, that is one is Astacus, that is river crab, Astacus fulviitis, ASTACUS. That is also a remedy which is urticaria aggravation night, especially in January, February, what you told. You must use that. You must think that also. And one more remedy, of course, I told you that. One more remedy that you should think about in those complaints. Of course, you must have used Artica urens and all. I had told you once a remedy called as Triosteum perfulatum. That is, I think the common name is fever root, whatever I can remember. Triosteum perfulatum, that fever root, and other remedy which again I had told you before, if you remember, that is Tila europea. So these remedies are also very useful in those type of complaints. Sorry. Sir, ASO titer 22-25 with joint pain, knee joint stiffness, and weakness of legs. Normally in titers we get these type of complaints, but still, if you still want some remedies for that, there are a lot of remedies for that, these symptoms. But normally, see, streptolysin O titer is high. Of course, you can think about remedies. See, It can also be taken that when the patient suffers from recurrent tonsillitis or recurrent streptococcus infection, now that has gone to that heart, and now the ASO titer is high. You can think about remedies like ammonium carb or abrotenum also. But if you have asked me some specific remedy, think about arsenic, think about bryonia, causticum, calmia, petroleum, and rustox. 15 years, headache, occipital 3 months, accompanied by sweating, sometimes nausea, increasing a day progresses. Yeah. So we had, I have started this, migraine clinic. So it is very nice. So we are getting a lot of cases of migraine, and the patient first comes and tells us, sir, migraine तो ठीक होता नहीं, डॉक्टर ने बताया हमने ये दवाई खाए वो दवाई खाए और फर्क ही नहीं पड़ रहा है. But of late, just it's been I think first May we started, and now I have about 21 patients of migraine registered, and we are now having concentrating on those migraine patients and the gastrointestinal liver complaints and all. It is fantastic, and it is very it's very what you call fascinating that so many people basically want homeopathy now. And I'll tell you the results of migraine, whatever I get, maybe in few months to come. In this case, coffee, yeah. So, Dr. Amol, you must think about few remedies that should come to your mind. First of all, think about natramur, think about lachesis, think about kali carb, think about, I think you should think about, I think carbon sulfur and calcarea also in these cases. Poor PCOD, you can think about this remedy. Yes, this is a very common itching, well, and dressing. Wants to give after what to give. No, see, Dr. Abhijit, one thing I'll tell you that when I was very young in my practice, about 15 years back, and this itching while undressing, was such a common symptom. Every second patient of skin came and tell me that when I come home, when I take off my pants, take out my shirts, and I start itching. And I had used so many remedies. I've used these remedies like Rumex and all. It does not work, or it works only temporary. In those cases, make sure that you take the case, because the patient might have aggression from wind, aggression from cold, aggression from undressing, and take the whole rubric and then go. Otherwise, Kali Ars is there, Rumex is there, tuberculum is there, petroleum is there, rustox is there, a lot of remedies, but it only relief temporary, In my simple as that. When the patient comes and tells, I'll tell something about cough, which basically I have got a lot of cases, and the patient says, डॉक्टर साहब सूखी खांसी है और बस कंटिन्यूस चलती रहती है, बस एक कंटिन्यूस चलती रहती है. In that case, you must think about first remedy. Or the patient says, मैंने कल खट्टा खाया खांसी होगी, ठंडा खाया खांसी होगी, ये खाया खांसी, वो खाया खांसी. Alumina. You must not have never used alumina in practice, but alumina is a fantastic remedy. When the patient comes and says the cough is continuous, whether I eat, I drink, I lie, everything cough is continuous, the remedy is alumina. Or the patient comes and tells you that whenever I go to sleep, I cannot sleep because of the cough. Then the remedy changes. Then you have to think about Lycopodium, Pulsatilla, Rumex, Rustox. But when the patient comes and tells you that my child starts coughing in the night, he does not know. He is sleeping. The parents are complaining. Then you have to think about remedies like nitric acid, chamomilla, and arnica. Or the patient comes and tells you that I have lot of cough and I have to wake up from the cough. Now this is a very important remedy, because most of the patient will come and tell you that we have to wake up from the cough. The cough is so severe. Think about hyoscyamus, but first think about causticum, sulfur, phosphorus. These three are the very important remedies where the patient comes and tells you that the cough awakens the patient. Some patient comes and tells you that I start coughing, I wake up, then I cough, then again sleep down. It disturbs me, but I get the sleep again. Then the remedy changes. That is sulfur, lachesis, silicia, and nitric acid. So these are the type of cough, dry cough almost, and in relation to sleep. There are a lot of combination, but whatever symptoms I have got today in my practice in relation to sleep, I'm just answering that question. Of whatever mater medica basically I remember. So I have used agaricus in a child, 7 years. He used to continuously blink his eyes, creating problem in school, seen by the teacher. Yeah, that's a very interesting blinking of eyes is such a troublesome problem to the teacher, to the parents, and to the child also. In these type of complaints, you must think about few remedies. And those remedies are very, very useful. Who has asked this question? Dr. Gupta. Belladonna, Calcarea carp, Crocus sativa, Calme latifolia, phosphoric acid, and Naxomica. Yes, uncle. Amol. Thought of chronic migraine but no photophobia. Yeah, see what happens in case of migraine. When you take the case, the patient of migraine comes and tells you, when I have a pain, I like to vomit. I don't like perfume. Headache increases. When I'm in the light, the headache increases. With sound, the headache increases. I want to eat something very cold, something very spicy, something very soda type drinks. But when you prescribe on these symptoms, it will only temporarily relieve the migraine. Because as such in migraine, all these senses are very alert. And you prescribe on this symptom, the patient is better, but comes back again. If you prescribe on the symptom, comes back again. That's why we had so many cases of so many symptoms of migraine. So I have few assistants who are working with me. So we have given those migraine patient to somebody, gastroenterologist. So we are working now on homeopathy specialty clinics, and trying to identify what exactly happens in migraine, how does it occur, why the patient goes for fatty liver, in spite of eating very bland food also. So we have, or why the patient suffers from IBS or ulcerative colitis in spite of very healthy diet, in spite of no stress in the life. So we have opened specialty clinic, and we have good number of appointments for migraine, for gastroenterology clinic, for liver problems, for this. So we have started a specialty clinic with few of my assistants are they helping me, and in course of time we will discuss why this disease occurs, migraine types and all. Okay, so photophobia and photomania, and these are very common symptoms of migraine. You will get in a lot of cases. Chilliness of lower extremities, how to approach? Just chilliness of lower extremities. So basically, we are not treating in the parts, Dr. Amit. So if you're treating only in parts, then basically you can take this symptom. But just because the patient feels chilliness, especially in the lower extremity, of course, if you want to know the remedies, I can tell you the remedies. Think about sepia. And I had a case, and I had basically prescribed because of chilliness, the symptom Paris quadrifolia. So write down sepia, Paris quadrifolia, ignitia, and Merksol. Chilliness in the lower limbs, but it's a local symptom. So make sure that you take the whole case. But these 4 or 5 remedies you should think about. So I hope everybody has been satisfied what answer I have given. I have tried my best, whatever I could recollect in Mathematica repertory, because it is such a spontaneous answer I cannot think of. And it's already 1 hour. I hope you understood, and we wait for Amit so that he can make a good group and we can start the Google Meet also. So thank you everybody. Thank you for your patience hearing, and I hope you grow in your practice and give good results to the patients. Thank you so much.